Welcome to another wonderful edition of your favorite program, Health Affair on AIT, a platform where we focus on public health challenges, issues about women and children, with a view to providing lasting solutions. I am your regular anchor, Ushuomowa Daniels. Our focus this week is on stroke, and we'll come back to that after our new segment. Please don't go away, stay tuned. Malaria is a mosquito-borne disease that has continued to be a health challenge despite being preventable and treatable. In 2020, there were an estimated 241 million new cases and several deaths, with more than two-thirds affecting children under age 5 living in Africa.
We know that malaria is one of the highest killers in the country, and there's still a lot that needs to be done.
Though there have been several efforts by various partners to eliminate malaria, the emphasis many here believe has been more on curative instead of adopting the vector control strategy, given the high rate of dirty environment in most cities that provide the breeding space for mosquitoes.
More of enlightenment and partnership, and also stretching out a hand of fellowship to other stakeholders. So still want to see areas of partnership whereby government comes with the private sector and partners in malaria control, in mosquito control. Most of us are members of international affiliations, and pest control bodies across the world, and there's so much, innovations in the fight against mosquito in the country. We look forward to such partnerships. You kill mosquitoes, you kill malaria.
Going forward is private sector involvement in program implementation, and for the private sector to even recognize government, people in government.
The health practitioners also called for a more business-friendly environment by way of subsidizing healthcare equipment and reduction of taxes.
Hope that in the nearest future, government would allow small businesses the ease of doing business, especially in the area of health. You find out that we are health practitioners, and you still find the situation whereby our members are being harassed by local governments and some other government agencies across the country.
The event, which was the 2022 annual general meeting of the Pest Control Association of Nigeria, PECAN, saw the national president, Olakunle Williams, being re-elected for another 4 years.
PECAN is a body of professionals in the practice of pests and vector control in the country. It's a national body of professionals in this field, and the journey to where we are today has been long, and of course it had been an issue of recognition, and today we stand tall amongst professionals in that area of bringing to the nation solutions to vector management. Of course, by vector I mean carriers of diseases in pests. Of course, mosquitoes, rodents, and some other pest organisms are vectors of different kinds of diseases.
Many stakeholders in the health and environment sector who have contributed in various ways to ensure disease prevention were honored.
It's an award that the Honorable Minister take with all seriousness, and that was the reason why he mandated me to be here for the ones that he has to be at the Federal Executive Council today for the weekly meeting, and he felt it to be out of place for him not to be properly represented here, and that's why he has asked me to come in from Abuja to come and represent him at this function with the seriousness which he attached to PECAN because they are collaborators in the management of environment, and he does not treat such association or body with levity.
The first 2 cases of HIV in Nigeria were diagnosed in Lagos in 1985 and reported in 1986, one of which was a young commercial sex worker. Then, it was more like a death sentence to be diagnosed of the disease, but now all that has changed. Young Ayomide, for example, has managed the disease for 16 years running.
I became more strong by accepting who I really am. I know I am positive, but I have my legs, I have my hands, I have my brain.
Despite this success story in Nigeria, HIV has continued to remain a major public health challenge that affects millions world over, and this requires a collective effort to address according to stakeholders.
Think about what an amazing story it is that this country has achieved what it has to put on the verge of HIV epidemic control. Really, the United States is so proud to be a partner in this, but really bravo Nigeria. It's a story really to be proud of. So we need to get to the final mile by getting to people who are in marginalized population, getting to children, make sure that everyone has access to health care to be able to control, know their status and control their HIV.
Mode of transmission, by having multiple sexual partners, by using sharp objects. You can even contact it by, if you have deep kissing and you have wounds, sores in your mouth, it can penetrate. And then for drug addicts, those that use unsterilized needles. And also the bisexuals and the gays, because most of them don't do protected sex. If you are active as a youth, please use condom.
You know, when you keep sending a message across, in the long run, it will stick regardless. So people that want to pick it will pick it, and the stubborn ones will still not get the message. But at least the people that saw us and saw the importance of different groups coming together to pass a message across would definitely get the message and most likely would practice what we've been preaching.
This is me on behalf of the Right Honourable Speaker, Right Honourable Mudashiru Ajaya Basa, and every other member of the Lagos State House of Assembly and Nigerians, plead with everybody, every Nigerian, every Lagosian, to stop stigmatization and realize that everyone has to equalize, that we all have equal rights to existence, to fundamental human rights.
Know your status. So we have free ATS services that Mr. Governor provides in all the 20 LGAs and the 37 LCDAs, in our primary health centers, in the general hospitals. So know your status today, so that when you know your status, you can be started on free antiretroviral therapy.
World AIDS Day is a global event marked on the 1st of December every year. This is a gathering of women optometrists in Nigeria. Optometrists are healthcare professionals who provide primary vision care ranging from sight testing, correction to provision of eyeglasses to people when the need arises, among other responsibilities. During deliberations here, their hearts went out to Nigerians, especially rural dwellers who are more at risk of preventable blindness due to lack of access to care and quackery.
We want to see eye care to be accessible, affordable for everyone, including the less privileged, children, the girl child, and those who just cannot afford it. That's why we are here.
Instead of coming back to this place that is overpopulated with our professionals, let them go to places where the professionals are not there to make eye care services accessible. Here even we encounter a lot of blindness and malpractices.
We're making sure that the quacks don't exist because they are increasing the rate of blindness here in Nigeria. And another thing we also are trying to ensure is for government to create employment opportunities for our members. And these optometrists will be well remunerated, because if you notice, there's been an onslaught of brain drain. A lot of people are deciding to pick up jobs outside the country, and if we don't intervene on time, very soon we'll have no doctors left in Nigeria. What we say in the Nigerian Optometric Association is check your eyes yearly, because when you're able to determine some issues in your eyes, it will be corrected on time.
They noted that a larger percentage of the blind cases were from preventable causes like cataract, glaucoma, refractive errors, harmful traditional eye practices. The event is also part of activities to celebrate the 16 days of activism against gender-based violence. The theme of the conference, The Empowered Woman, also raised the challenges of women in the optometry profession.
Now, the empowered woman is someone who is in control. The empowered woman is someone who is knowledgeable. The empowered woman is someone who is strong, who is, who really generally can control everything around her.
Encourage us as women, because as women we do a lot. We attend to every member of the family except ourselves. So this program is meant to ginger us, encourage us, and make us better versions of ourselves.
This is a women's conference. The woman is an empowered species. You must believe in yourself, and you must believe that with you can turn around the fortunes of this great country.
Women were advised against being intimidated in their chosen profession or goals by societal and cultural biases.
Optometrists are vital to primary health care because they are the primary health care givers. So it's actually worrisome that in our health system in Nigeria, in our primary health care, there is no provision for eye care for the people. When you come to the primary health center, there is no optometrist that is employed in the primary health care center. This is worrisome.
Dr. Odede Oluwatosin Joseph has demonstrated what Nigerian youth can accomplish when they set their minds to work. He was posted to Ilasha Primary Healthcare Center for his one-year compulsory youth service. He identified a major healthcare challenge in eye care and pursued his dream of leaving a lasting legacy with this world-class eye care center being commissioned here today.
When I was posted to this health center as a doctor, the patients I got to see, I discovered that there's a high prevalence of preventable blindness and eye diseases among the people, but it doesn't commensurate with the eye care system on ground. Like there was no space for doctors to even see patients, no equipment, nothing. Like as a doctor, get to see patients in the reception hall, so it's kind of deplorable. So that's what prompted, okay, after the first start, we need to get an eye clinic center, then equip it for the people of Ilasa and Isolo at large. I did not use any of my personal funds, so I sourced for funds from different sponsors. So I got sponsorship from any eye care, Dr. Chuendu, then from Mopsing Pharmaceutical, from different optical, Sony White Opticals Limited, from different firms, and they helped. They helped a lot. I'm very happy because at least now we are sure that the people can get quality eye care. At least from Mondays to Friday, they can see quality, they can get quality eye care, and the general hospital last week they can be decongested.
I feel very happy that this project is coming to place today. A few months ago, we were here to commission to start the foundation laying of this eye center by Dr. Odede. Odede will be like an inspiration to others, so that anywhere they find themselves, they must identify needs in the local community where they can now build on to be able to leave something positive behind where they find themselves.
When it came to me that he wants to build a center for the community, I was scared. When he was on the camp, he told me he wants to distribute eye glasses to people. I told him, where do you get money? He said he would try. And he did it. He gave many eyeglasses to people there. Yes. When he came here again, he said he wants to build a center. I said, yeah, where will you get the money? I was so scared. I started praying for him. I said, if it is your wish, God will support you and God will be with you. When he told me he has completed it, when things were so he didn't know what to do, he came to me and said, Mommy, I don't know where to run to. The little I could, I assisted. I told the brothers and sisters, anything you can help him. So everybody rallied around, we supported him in our little way. And when he told us he has completed it, I was very happy. I could see him sweating. He's always moving from one place to the other, going to meet this one for assistance, going to meet that one for assistance, like that, all true. At times we get home very late. He said, I went to a place to see if I can see help, to make sure I complete it. So I'm happy, I'm glad. that we are alive to witness this.
The event also provided an opportunity to carry out eye tests and treatment with the provision of 100 glasses to people of the community.
We promise the Lhasa community will use it as a good product and we will take care of everything in there.
Harvest refers to the time during autumn when farmers traditionally brought in crops that supplied their community through the year. Though most foods today come mostly from the supermarket, Christians believe it is still important to remember God as Creator and thank Him for the good things He provides. During the youth harvest of the CNS Amazing Grace District on Saturday, 26th of November 2022, members didn't only appreciate God for His provision, but took our time to reach the needy, to meet their needs, given the prevailing hunger in the land.
Harvest is not just about giving food. Don't get that wrong. Harvest is about celebrating the faithfulness of God over the years that the Lord has released a supply on His people. Another thing that it gives us a remembrance of the last harvest that will happen when God is going to come and harvest His own to the throne and to the house that He has prepared for everyone. He said, in my Father's house, there are many mansions there. If you were not so, I would have told you. So He's giving us a mandate of fruitfulness. And the harvest is a significant ceremony for every believer of Christ to stand as a memorial of God's blessing to His people on earth.
We've been doing so many community service. We've been going from one NGO to another. We have been supporting NGOs ranging from the elderly NGOs. We've been going to motherless homes. As a church, we've been going there to support them. There's what we call a pre-harvest activity we did in the church. Pre-harvest activities comprises of widows in the church and around the churches around us. We are able to reach out to some numbers of widows around us and also in the church by supporting them with some token to seeing that we give them a facelift from what the challenges that they are going through as an individual.
I keyed into the Nigerian situation, believing that no matter the trying situation, God is able to make the harvest partakers and all Nigerians fruitful in all their endeavors.
God wants every living being to multiply in every aspect of their endeavors. God wants multiplication. In our growth, He wants multiplication. Over our finances, He wants multiplication. In our spiritual endeavors, He wants fruitfulness. He wants us to expand. And that's one of the mandates that He has given to us, as He has said in the book of Psalms 128. He said He's going to make us to see our children rounding our tables. The covenant of God, He does not want us to be single. He does not want us to continue to be limited. He wants us to expand. He wants us to be revolving. He wants us to expand. He wants us to enlarge. And this is what I pray for every individual. As we are partaker of this year's 2021 harvest, which is that harvest of fruitfulness. My prayer is that in every aspect of our life, where we look unto God for expansion, we will expand in the mighty name of Jesus, beyond our expectation, in Jesus' name.
Harvest of fruitfulness, particularly we have to pray to God that He come and help us pass through Nigeria, to intervene and help us to bring peace on the land, because there is so much pain in Nigeria. We are asking God through this harvest that God come through Nigeria and help us walk through the land and bring peace, so that we can understand the purpose of our existence here in this part of the world. Harvest of fruitfulness, particularly we have to pray to God that He come and help us pass through Nigeria, to intervene and help us to bring peace on the land, because there is so much pain in Nigeria. We are asking God through this harvest that God come through Nigeria and help us walk through the land and bring peace, so that we can understand the purpose of our existence here in this part of the world. They say health is wealth. You know, if you don't eat, then how do you get good health? Before you use any medicine, you must eat food. And right now, food is very, very expensive. I mean, very, very expensive. You can see how much you are selling. They are selling a bag of rice. Just for this program, I come to know that even a bag of rice in some location goes to the tune of 52,000 naira per bag. Then you can imagine, if minimum wage is at the range of 18,000 naira, then tell me, how can a common man survive without the help of God, without the grace that abound in amazing grace and the youth session. So I would want to encourage as many people out there to come and join us to see that God is here. Amazing Grace is all about raising champions for global impact.
Members of the Youth Fellowship also expressed concerns about the sorry state of the nation's health sector and worsening brain drain.
A mere man, ordinary man, cannot access free health care. When they get there, they will tell you it's free. But when you get there, they will ask you to go and buy hand glove, to go and buy one drug or the other. You pay for almost everything. The only thing that is released to you is only the bed. Even the bed, I heard that you have to pay 1,000 per bed space. So the more you stay, the more your money accumulates. So what are we going to do? Well, as we pray, we must take action this year. We must test people and make sure the real people get to the place of power and push them to work. The citizen has their own obligation to push our representative, either commissioner, either chairman, either governor, to work.
I think our healthcare system is in disarray, and most of our doctors are quite tired, and so because of bad situation of not paying well and lack of evening, they are all running out. But I think we can also improve it if we encourage our doctors and our nurses, because they spend so much years in school only for them not to be appreciated as a society and as a community. And I think even we as their patients that go to them, we also have to have decorum and treat the doctors with care. It's not our right. They went to school for their sake, and so it's just sort of a volunteer to the public as to treating this public, even if that's what they studied.
Last year was still a bit tense, but this year is getting better. So health-wise, isn't it? Health. Yeah, we thank God for life. I mean, people expected that people died, especially in Nigeria. In Africa, that we'll have a lot of dead people, but we thank God that He's been there for us. God sustained us, and we're grateful for that.
The event also provided an opportunity to offer prayers for Nigeria. On Saturday, the 19th of November 2022, Lagos Metropolitan Lions Club, District 404B2 Nigeria, in conjunction with White House Nigeria Limited, carried out an intervention in the Sheri area of the state to mark the 2022 World Diabetes Day. The event featured blood pressure monitoring, diabetes tests, and treatment.
We have come to discover that one of the medical challenge that most Nigerians are having as of today is mainly diabetes, and most of them go about their business without even knowing their health status. So having discovered that this is a major medical challenge, we organize this program, one, to sensitize people, provide medication or referral where need be, and also to create an awareness that will enable people to carry out what we call periodic check of their sugar level, their high blood pressure, and so on and so forth. If I may shock you, in our last diabetes program, we were able to carry out check on almost about 1,000 Nigerians within the Agege metropolis. And what we discover is quite shocking. One, we discovered that over 61% of those who were tested had high blood pressure, and relatively 28% had low blood pressure. And it's an issue that calls for great concern.
It is alarming, not only in Nigeria but at the world at large. That is why Lions Club, as the largest humanitarian club in the world, has taken it upon itself to wage war against diabetes, because it is more deadly and more alarming than HIV/AIDS. The take-home message is try to live healthy, stay healthy, and make sure you go for tests as much as possible.
I think when we talk to 3, 4, 5 people, hardly you see 2 people having it normal. The situation of the country too can make things like that occur in many lives. We all know the stress people are going through every day. We know it's not every family that can afford to eat the balanced diet as is expected. But the little we can do is what is an example of what we're doing here today. And what we would like to tell people is, after today, for those who have done their check-in, I'm sure some came here today and that's the first time of actually checking theirs. So for those who now have the information of their status as an health status, they've gotten advice from the personnel of what to do.
The cause of diabetes is what we take. Like the sugar, even the food we eat. You know, this is what accumulates sugar in our body. And we need to control it. Because once your sugar is high, it can spring up some kind of, disease and other things in your body.
It was wonderful because now I'm told that my BP is low. Without this, I wouldn't know. So I will urge people to always check their BP, check your sugar level to know the state of your health. And we should always exercise our body often and always see the doctor.
Chartered on the 9th of July 2020, Lagos Metropolitan Lions Club has distinguished itself with many outstanding projects to better humanity, part of which is this diabetes intervention.
Within our jurisdiction, which is okey and Beggars, we are going to provide an ICT center where we are going to equip it with computers to enable the people within the 3 schools that we have identified to now have access to proper computer training. We also have, as a tradition, as also as a standard in the Lion Club, we have our monthly activities, which entails us doing activities every month on certain selected areas, which involve childhood cancer, environmental protection, and so on and so forth. So most of all these activities require certain and special needs. We have also looked at certain areas and we have discovered that we need to make provision for white cane to be blind. We also need to provide food in December for the needy. We also are planning to carry out programs in correctional centers, both for boys and girls, and also provide food for them. There are a lot, and most of all these are contained in our brochure, and that is why we believe as Lions that we have agreed by becoming Lions that we are going to give our time, our talent, our treasure, and we are going to harness it to pull the institutional framework to support us to achieve it.
The founder of Emeka Agba Foundation, a non-governmental organization, has called for collaborative efforts to address poverty and poverty-related challenges in the country. Speaking at a news conference in Lagos, Chief Emeka Agba said to address some of the sustainable development goals of zero hunger, good health and well-being was critical to tackling the insecurity challenges confronting the nation.
Food insecurity is one of the biggest problems because first, those that will go to school, they will need to eat first. Food, like they call it stomach infrastructure, is absolutely very important. So what we do is that we try to reach out those that are badly affected in different communities.
The philanthropist noted that humanitarian service is needed to address youth empowerment, mentorship, health, and creating an enabling environment for socio-economic dependence of young Nigerians. Also concerned about the nation's health sector, Chief Emeka Agba disclosed that the foundation is willing to partner with medical doctors.
We'll be open to receive some medical professionals who are experts in those fields. Then we will sponsor them and make sure they can sit out and receive people who need such care.
The foundation has been working over the years to address critical issues and challenges such as hunger that affect mostly people at the grassroots.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through relevant information.
Welcome back. Many Nigerians are coming down with stroke. Lack of access to treatment and out-of-pocket payment further worsens the situation. Listen to our story about Mr. Harrison Ibekwe and see how you can be of help, because it can happen to anybody. This is Fashino Adio Street. We are going to house number 3 to see Mr. Harrison Ibekwe, a Nigerian in his mid-60s battling with stroke. Aris Ibekwe is in his mid-60s. He was once a vibrant and active man who worked very hard to fend for his family. But the story of his life changed when he had a stroke attack in 2014 that affected his right hand.
Last place I was working, when this attack came, I call it attack because I didn't expect it. Institute of Safety Professionals of Nigeria is born. That was the professional body I belonged to. And that was where I was doing a lot of job. A lot of job. And it was paying. I was on one of the jobs, safety audit. I went for safety audit of an organization. By that time, I was auditing places. I was going for audit job in places like Sokoto, in Kano, Kaduna, name it. This is a corporate audit assignment. So in one of those visits to Abuja for safety audit, when it started, so I didn't know what was going on. I didn't even know that I was looking at the whole thing to be maybe stress of the time. I was not having appetite. That was first time I was having some feelings. What's going on? I could not have appetite for food, even biscuit. I noticed that I could not try it again properly. My hand was, instead of going like this, it started going up and down. What kind of a thing is this?
Mr. Aris Ibekwe has spent all his life savings on treatment, contributions from friends and family members that helped to sustain him till now, and no more coming. No thanks to the prevailing harsh economic reality.
There was a comeback. This thing came back in 2020. Yeah, 2020. It struck again in a bigger way. Again, I could not talk. I could not. The second attack of the thing, because the first one that time it came, I could not talk. It came again this time because of hunger. That was during the time of COVID. It was tough. No medication. No good food. No diet I should want to. That was the type that came again, and up to today. Up to today, that had been the biggest problem. I have some friends, so many of them, they were helping, but it came to a point where it was difficult again for anybody to help per se. And in fact, can you imagine if I tell you that a day will come, I will not see anything to eat in the family. My wife is a teacher, and she cannot do more than she can cook. She has been trying her best. I need treatment. 1.6 million. If this paper, can you get it? Is here. 6 million. The place, the last place that I should, that I will be treated is okay for you. That I will, oh God. 1.6. I could not afford 1.6. The need for help is very much. If I see the government of today, if I see anybody, the corporate bodies, NGOs, anybody who can help, philanthropic organization, just for me to be exposed to treatment.
Stroke is a medical emergency that occurs when there is a damage to the brain from interruption of its blood supply, and this can be caused due to a blocked artery or bursting of a blood vessel. More than 100,000 cases are recorded annually in Nigeria.
There are two main types. One is due to the gradual narrowing of the blood vessels. We call it blood vessels in the brain. We call it ischemic stroke. It's more common. In other words, those blood vessels start getting narrowed over the years due to deposition of fatty deposits in the blood vessels, and that can result in a stroke. That one is more common. That one is called ischemic type of stroke. The second type is the hemorrhagic type of stroke, which occurs when a blood vessel ruptures or bursts. When that happens, you find blood spilling into the blood tissue and so on. It's not as common as the other one. It's just about 5 to 15% of the cases that have the hemorrhagic type. So one is due to narrowing of the blood vessels. The other one is due to narrowing leading to blockage of the blood vessel, and the other one is due to rupture of the blood vessel. We don't normally talk of which one is more deadly. The two are deadly. I mean, the same statistics back the two of them up. In other words, if somebody has a stroke, consequences of dying or not does not depend on whether it occurs on the left or the right. A stroke is a stroke. It's increasing, especially backed by WHO statistics, which has reported that in recent years there's an increase in cardiovascular diseases, including stroke, in low and middle income countries, and Nigeria is one of those countries. Who are at the risk of having a stroke? It's everybody, but the risk increases with age. So older people are more likely to have it. But there's one important factor that is a very predominant risk factor for stroke, and that is high blood pressure. In other words, if somebody has elevated blood pressure that is not controlled, the blood pressure keeps going up and you are not under medication or anything to control it, one is at a risk. So high blood pressure is the most important risk factor. Cigarette smoking, excessive alcoholic consumption, excessive body weight, that's obesity, and so on and so forth. With all this, if anybody has any of this or a combination of many of them, is at a higher risk of having a stroke than the general population. You have the paralysis or paresis either on the left or the right, depending on which part of the brain in which the lesion occurs. The general observation is this: if the lesion occurs on the right side of the brain, then the person will have the paralysis or paresis on the left side of the body. And if it happens on the left side of the brain, you will have the paralysis or paresis on the right side of the body. That's why you have people having it on the right or on the left. Those who have a stroke, 30% of them may die immediately. After some time, another 10% may die. The rest will be left with a number of impairments, and they can once they have survived it, they can live with it for many years thereafter, depending on the type of care they got and the rehabilitation they go through thereafter. Care is available in different hospitals, primary health centers, general hospitals, teaching hospitals, and so on and so forth. One can access care there. It depends on what you do immediately it occurs. Know the right place to go. Most of our hospitals, when you go there timely, immediately it occurs, you have people who will look after it. Those who will give the immediate care and those who will take care of the rehabilitation thereafter to ensure that you get the type of treatment or follow-up care that stroke needs.
Though stroke is incurable, treatment can be of help. But this treatment, due to its high cost, is out of the reach of many Nigerians.
Stroke is one of the conditions that can happen, and one can manage it through the National Health Insurance. But then how many people are enrolled on the National Health Insurance? But just as you said, it's not something that is inexpensive to manage. It's a high-cost neurological condition. You need money, you need resources, you need people to be able to manage it. Immediate people, we call them carers, who are close to you to assist you in different forms of rehabilitation that the patient needs. So it's very costly.
There should be provision made for people that are living with non-communicable disease to have special attention. Somebody who has stroke in the family in Nigeria today, when there's somebody with a stroke, that family is most of the treatment is going out of their pocket. The money they are supposed to use for their daily living is what they will be using for the stroke. We don't have stroke centers in this country. How many stroke centers do we have? So what can the government do? What the government can do is to also to be able to look at having alternate funding for this special kind of people. And it can be done. If you look at even the budget we have for health in this country, I'm not sure we have scaled more than 8% of the budget. And even out of that 8% of the budget that have been paid, that is being said, how much of it really goes into really being released to finance health? So I feel like what you say, alternate funding is what we need. And the Basic Healthcare Profession Fund, I'm an advocate of that, and I believe this is what is going to help people live with NCDs, non-communicable disease. And I do know that the Basic Healthcare Profession Fund, there's also an advocacy in it to include non-communicable disease. Because initially it was, when the guideline was released by the federal government, it did not include non-communicable disease. But it is now being included, and I hope that is also going to be a saving grace for people living with non-communicable disease.
While many Nigerians are appealing and hoping for government policies that will improve access to treatment for stroke patients, many are of the view to invest more in prevention, since some of the causative factors can be controlled.
We don't eat food that is too rich in fat or fatty substances that can also increase the formation of plaques that can block or reduce the size of blood vessels that can lead to a stroke. So you avoid fatty food. You eat what we call, well, maybe we are not used to that term here, Mediterranean type of food. That is type of food that is rich in fruits, vegetable, whole grains, and so on and so forth. And eat less and is less in salt and so on and so forth. Those things that are not desirable for the body. One should monitor his blood pressure on a regular basis, so that once it is getting high, then you now consult, seek medical attention to do what? To ensure that it doesn't go beyond normal. The normal limit is what you call 120/80. So once it is going above maybe 140/90, it's getting high. So control it. Once you control blood pressure and your blood pressure does not become high beyond that normal level, then that's the most important vital sign you should watch out for in control of stroke. So apart from blood pressure, watch your diet, the one we have talked about before. Then if you are a smoker, stop smoking. If you are drinking, don't drink excessively. Then control your body weight so that one does not become obese. If you take all these measures together, those who are diabetic, they should control the diabetes. So if you do all this, then you are already talking of all the preventive measures that you need, and that it applies to any one of us.
Stroke is not a death sentence, and you should know that it's preventable as well as treatable, you know. And all that I would advise people, Nigerians, is to ensure that eat healthy foods, you know, lots of vegetables and fruits and all the good diets. Then the people with hypertension should use their drugs, you know. All those things are very important because you should know your numbers. If you know the numbers, you'll be able to know this, my blood pressure is going high and all of that, you know. And when you see signs that feels quite abnormal, then such an individual should come to the hospital and then get checked, you understand. It's not until something really drastic happens that you have to report at the hospital. Then for those who believe that Christ will heal them, you know, whatever faith that they believe in, and they take their relatives to the hospital whenever things happen, I would not say you should not go to church, but the health is different from our faith, you know. So when you come to the hospital and you get well treated, then you can always get your prayers and all the other things. So the church is not the first place to take your relatives to when stroke occurs or whenever you're not even feeling well in every way. Just come to the hospital, get tested, then you know exactly what is wrong and all the treatment that you are required to, you know, take.
If you are just joining us, it's Health Affair on AIT. Next on the program is our nutrition segment.
It's a common saying that you are what you eat. This is why we make it a point of duty to give you information about food items, fruits, and their nutritional value to help you make healthy choices on our nutrition segment every week.
Locust bean, commonly called iru in Yoruba, ogiri in Igbo, and daddawa in Hausa, is a local seasoning used in preparing soups and stews. It can also be referred to as the African locust bean, with the botanical name Parkia bigiobosca. The locust bean can be found in a wide range of environments in Africa and is grown for its pod that contains both sweet pulp and valuable seeds. Research shows that locust bean helps to promote good eyesight and aids in treatment of health conditions like hypertension, stroke, diabetes, anemia, and malnutrition. Consuming a good amount can equally reduce fever and boost the immune system. The most valuable part of the locust bean is high in protein, carbohydrate, fat, calcium, and other vital nutrients cherished by the body. Consuming locust beans is good for your health.
On our clinical segment, we give you tips for healthy living.
If you take medicine and you go and put it in a very hot place, because that medicine is what is a chemical, so that chemical will begin to react with itself. Or if it is a place that is moist, it will absorb moisture. Sometimes even if you put garri down, it takes water and it swells up. Same thing happens to medicines. So when it begins to react, it means that that thing that is inside that medicine is no longer what the manufacturer manufactured in the first place, and it can have any kind of effect on the patient that takes that medicine that is bad.
Join us on our perception segment on how to improve human lives and the nation's critical infrastructure.
The hospital generally, if I may put it that way, they are a disappointment to we citizens, in the sense that when you rush your loved one to the hospital for emergency, the way they will ignore you, the way they will talk to you.
Thanks for spending your time with us. Please, let's do it again same time next week. Don't forget to advertise your product and services. We do it for you at a subsidized rate. I am yours truly, Oshomowa Daniels. Please keep staying safe.